Thriving Con. We are so excited to have you all today virtually. Um, if you would like to have closed captioning on, there should be a box on the bottom of the screen on Zoom that says closed captioning, or we'll have that CC there. So if you would like to do that, I think it used to be that you could turn it on for everyone, but now I think you have to turn it on for yourself if you would like that option. If you need any help turning that on, you can chat Jenny. She's our tech guru. Um, and if you're just signing on as well, if you have a name that is different than the name that you registered with, if you could please change that to your full name, your first and last name, so that we can take attendance. If you don't know how to change your name in Zoom, you can just send Jenny, again, Jenny the tech guru, a chat with your name and she will change it for you. We want to let folks know that when you registered, if you sent in a question, we've already forwarded those to our speaker today. So hopefully you will get to those. And speaking of questions, so Jenny will be muting everyone, but Bryan, our speaker, is happy for you to put questions into the chat throughout the presentation today, and I will monitor the chat and can ask questions for you. You can also unmute and ask your question directly if you'd like. There will also be time for questions at the end, and our speaker will send the slides to us, and we will share them along with the video of today's presentation on our website, hopefully sometime next week. Let's see. So if you are able to keep your camera on, that would be great, because we know speakers love to speak to faces when possible, but we also know there may be many reasons why you are keeping your camera off, and that's fine too. But if and when you're able to put your camera on, we encourage it. All right, well, without further ado, my name is Shoshana Funk. I am the social worker and clinical services manager of helping at Jewish for Good. My colleagues are here with us today, Stacy Abramowitz, Jenny Schwartz, and I think Jordana may be on. Thank you for joining us for this special program funded in part with grants from the Carolina Foundation for Jewish Seniors and the Leon Levine Foundation. A little bit about our helping department. We offer a comprehensive range of services that help people meet life's challenges. We deliver high quality professional social services for adults and their families through all stages of life. This includes counseling, case management, financial assistance, food pantry, and programs like this one. Much of what we offer is free, and all of it is open to everybody, Jewish or not. For more information, I invite you to visit our website, jewishforgood.org, to look at some upcoming programs we have planned, like Shmooze and Nosh, Care Partners Support Group, and Memory Cafe programs. So to introduce our wonderful speaker today, we have Bryan Godfrey. He's a licensed clinical social worker at the UNC Geriatrics Clinic. His presentation is Caring for the Caregivers. Bryan Godfrey is a licensed clinical social worker at the UNC Geriatrics Clinic in Chapel Hill, where he has served seniors and their caregivers for over 6 years. Originally from Pennsylvania, Bryan earned his master's degree in social work from the University of Pennsylvania and provided mental health counseling to underserved adults in North Philadelphia for over 4 years. In his present role as a case manager at UNC Geriatrics, Bryan's responsibility is to help assess patient and caregiver needs, then to facilitate connections to the supports and resources that can help everyone lead a happier, healthier life. Bryan currently lives in Durham with his wife, Janice, his cat, Farisha, and his dog, Squirrely Temple. Love that.
Thank you.
Passing it over to you, Bryan. Thanks so much for being here today.
Oh, it's my pleasure. We have one addition to the family as well, a new dog we just adopted named Little Mama. So that's the one y'all saw on the camera earlier. So anyway, thank you guys so much for being here. It's such a pleasure. The conversation about caring for the caregiver, I think, is so tremendously important and one that we sometimes overlook. So I'd love to share my screen here, share some knowledge with you today, and then hopefully we'll have ample time for some discussion and questions as well. All right, so this is our goal, right? To end up on the beach. Well, we'll see. Maybe. Caring for the caregiver. Let's give it a roll here. All right. I'll move this out of the way. All right, cool. So sometimes, of course, caregiving can be a joyous responsibility. It can be something that we didn't necessarily expect, or maybe we did. It can be a wonderful way to spend time with the people we love and care most about. It can even be an opportunity to set aside the things that we usually preoccupy ourselves with and refocus on what's important, spending quality time with the people that we care about the very most. And so you might feel like this as a caregiver, spending time with dad is the best. But there's another side of caregiving too. Sometimes it's a little more like this. I'm going to move this bar out of the way so I can see my presentation better. Cool.
Blue, stop.
Speaking of dogs, sometimes it's a little more like this, that we can just be exhausted. Caregiving can be tremendously difficult. It can be very, very stressful, and we might get some thoughts that we're not proud of. I like to reinforce with everyone that just because you have a thought doesn't mean that you're a bad person. Don't act on the thought. If you're worried, talk to a therapist, but it's usually not a concern. It's just a sign that you're experiencing a great deal of stress. So you're not a terrible person, but please don't push your loved one down the stairs. Let's talk a bit about stress. This is something that we all kind of already feel like we know about, but when we really stop and think about it, there's a lot more to it than you might initially think. So, stress is very difficult to define, and people have dedicated their whole lives to doing it. But I kind of like this definition that stress refers to a perceived threat and how our mind and our body responds to this threat. There are many physical factors that will impact your stress response. So, for example, your physical health will play a big role in this. Are you getting adequate nutrition? Is it something that's healthy? Are you getting sufficient exercise? How is your sleep, right? And we all kind of know this stuff is really important, but most Americans don't pay much attention to it and don't do a great job with this. So there's definitely lots of opportunity here for improvement. Paying attention to mental health in terms of your self-talk, your coping strategies, the skills that you use to manage your emotions. A significant portion of the population has a mental illness. The numbers vary pretty significantly, but I think it's safe to say something like 20 to 30% of us, maybe more, probably experience something like this. And right now, as we're experiencing financial hardship and all sorts of things here too, I think it's easy for us to um, experience these conditions that we don't necessarily pay attention to. And of course, your culture and your social group can significantly impact your level of stress. So, for example, if you are in or familiar with a culture that is very sort of communal and that people tend to share the responsibility, tends to be very family oriented, you may have an easier time with caregiving. Whereas if you are in a culture that is more individualistic or family oriented in the sense of just your nuclear family, no one else involved, you may have a more difficult time. Of course, your resources, including your finances, but also just the other things, the people and the other resources you have access to in your community will have a big impact. If you have supports, then even a significant stress might not be traumatic. But if you don't have any supports, then even a relatively minor stressor could become traumatic. And speaking of trauma, things like your past experiences can play a huge role here as well. What have you been through? Did you feel supported going through those? Do you feel like you can go through challenge again, or is it something that's overwhelming for you? The other aspect that I'm fascinated with in all of this is perception, right? So your perception of the situation, of yourself and others, and of your ability to cope plays a tremendous role here. If you believe you can do it, then you can often do it. If you believe you can't, you'll probably struggle with it. But so there's a lot to do here. I'm trained as a therapist, as you guys heard, so I'm a big advocate of all caregivers having their own therapist to help work through some of these things. There's a lot you can do with reframing perception and sort of reframing thoughts and that sort of thing in therapy. And you can do some of it on your own as well. It's just easier when you have a partner. Now, finding the time for it, we'll come back to that piece. All right, so we've talked a bit about what stress is. And I can imagine that if any of you are not a fan of water or sharks, perhaps, then something like this could be stressful. And you'll probably experience what's fascinating is even just seeing the image, like it's not real. But if you have a fear of this sort of thing, you're probably going to experience that physiological stress response anyway, even though the cognitive one is trying to undo it. It won't be as severe because you can tell yourself, oh, this is just a slide in a PowerPoint presentation, but you might actually still feel that. Some people just seeing a video of a roller coaster, for example, they feel that stress response because that's kind of how the body works. The brain has difficulty distinguishing between a real and an imagined stress, and any kind of stress is going to impact the body on a physical level. Now, I'm not a doctor or nurse or anything like that. I'm a social worker, so I don't even know what half of these things are and what they mean. But I do know that there is a very strong biological, physiological response to stress. And this can be something that, even if it's a minor stressor, you can experience that physical sensation. Then your brain is going to interpret that physical sensation as being normal, dangerous, not dangerous, bad, good, whatever, right? But this just gives you an idea that when you experience a stressor, things start happening in your body that are beyond your control, and you're under the influence of these hormones that your body is designed to react to. People talk about the fight, flight, and freeze response in situations like these, right? And that's exactly what this slide is just briefly illustrating, that there are tons and tons and tons of systems in the body that are impacted by stress. When hormones in your body change, it circulates through your entire body, and every aspect of your body can be changed by that stress. So people talk about the parasympathetic system and the sympathetic system. Parasympathetic meaning your rest and digest system, where you're sort of at rest. There's no at least no acute stress, maybe sort of chronic stress is low, and you're in a state where you can kind of relax, and your body interprets that. It relaxes as well and does what it needs to rest and digest. However, if you're in a fight or flight situation, some people say fight, flight, or freeze, then your body is responding differently. And on a physical level, your organs have actually changed. Your body is ready to act. And if you were in the jungle and needed to run away from a lion or something, your body is priming you to do that. The trouble is, we don't tend to live in jungles anymore, and we don't tend to have lions all around that we have to avoid. So now it's actually causing us more harm than good in some cases, especially if stress becomes chronic. Because you could imagine there was a time when, if there was nothing going on, there's relatively no stress. And now we live in a world where stress is omnipresent. And in fact, we often bring it upon ourselves. If we have a brief moment in the checkout line, we'll take out our phone, glance at the news feed. There you go, stress. Or is that just me? No, I don't think so. Here's a stress curve that you could think about. So I do want to be clear that stress is not bad. It's neither good nor bad. It's actually a crucial part of being human. And it can help us in lots of ways, but it can also be toxic. So I think it's important to realize that if you're under too little stress, that's a problem. You actually tend to feel bored. You get laid back and inactive, you get lazy, and it can be cool for a while, especially if you're feeling stressed out. But if you've ever had a time when you literally had nothing to do, it's okay for like 2 weeks. And then when you start getting into a month or 2 months, you kind of crave something to do. At least I do. I couldn't go that long. And so there's a level of optimal stress where you feel like there's some stress in your life, you're being challenged in some way, you feel motivated, and that can actually be really helpful. It makes you feel like life is worth living, you're doing something meaningful, and maybe you're helping others or bettering yourself in some way. Of course, if it goes too far, you can get to the level of exhaustion. And I think a lot of us experience this, right? So we hit this high point of stress, and then we sort of start to go downhill. Our stress is still high, or maybe it's intermediate, but we start to go downhill. And if this chronic stress continues, or if something too traumatic happens, it's going to result in burnout at the end, where we can have things like panic attacks and anxiety and depression and clinical symptoms like that. So it's not that stress is bad, but it's that many of us, I would argue even most of us, carry an unhealthy and maybe even unsustainable level of stress. There's things we can do to help with that. It's not easy, or we would have already done it. But, that's kind of my role here, is to explore this a little more deeply with you and see what we can figure out. So in this presentation today, I'm interested in exploring these three kinds of chronic stress, or three kinds of caregiver stress. So number one, of course, chronic stress. That's my poor zebra here. I think it's stress. The stripes are falling off. And I think a lot of us can empathize with that. Number two, lack of resources, another huge contributing factor to stress. We are surrounded by broken systems, knowledge gaps, behavioral gaps, lots of issues that make stress worse, basically. When it comes to our internal system, how our mind works and how we process information, I think the number one emotion that I hear from caregivers is guilt. And along with those comes some very powerful feelings of feeling like you're alone, you're isolated, like things have to be perfect and you have to try to protect against anything going wrong, and also having a lack of boundaries. I think a lot of us struggle with this, and especially caregivers who are already overwhelmed. So we'll kind of look at each one of these in a little more detail, break it down, and talk about it a bit more. So, chronic stress. Let's imagine, for example, here you are, you're chilling on the beach, you're in your lounge chair, you got yourself a drink of your choice, and you're having a great time. Now, what if I said you cannot put the drink down? Like, I won't let you. You're not allowed to put it down. You have to continue holding it. You can stay in the beautiful environment, but you have to keep holding that drink up. Keep holding it. Keep holding it. Eventually, you're going to break. Even a small amount of stress can be overwhelming over time. So I really want to make sure people understand that. It's not that you can't handle the stress, it's that it's been too long that you've been trying to handle the stress. And so we develop this chronic stress. Oftentimes, the thoughts and beliefs and behaviors that we exhibit make this whole thing much worse. So, for example, you may have unrealistic expectations of yourself. You may say, well, sure, I can hold a drink. Yeah, I can do that for a while. But then you underestimate how difficult it will be to continue doing that for minutes, hours, days. I mean, in caregiving, months, years, right? Especially if you didn't sign up for it and you weren't expecting it in the first place. A lot of us don't have very good coping skills. We don't know what to do when stress gets very high. Therapy can be very helpful in sort of exploring what type of support is the most helpful for you and helping you figure out how to put it in place. Many of us also engage in lots of negative self-talk. So, like the examples in the picture here, things like, I can't do it, I can't make a mistake, I'm not good enough, I'm not worthy. In terms of therapy, we often talk about cognitive behavioral therapy or CBT. And this can be particularly helpful if you notice yourself having a lot of these negative thoughts that when you really stop and think maybe aren't accurate, maybe aren't fair, or maybe just aren't helpful for you. And so a CBT based therapy can help you unpack these thoughts, see where they're coming from, and figure out if they're accurate, and if not, how to sort of change and reframe them. Many of us get very socially isolated. I think it's just part of the sort of average American culture to kind of be individualistic and on your own. And I think as a caregiver, it can be much worse because now you're stuck at home. You have to care for someone and you lose your social network of support. So that alone can cause the chronic stress. I'm sure we're all very well aware of financial hardship, especially now that inflation seems so high, prices seem up. Things are hard right now, and it seems like income's not keeping up. Many seniors are living on Social Security checks. Some people have Medicaid, so very, very limited resources. And we're trying to make do with this. When I started, you could get home care for right around $8 to $10 an hour. It was like 6 years ago. Now, home care costs 30 to 40 per hour, and people's checks haven't changed that much. So it's trying to figure out what to do with that. Is some people decide it's worth leaving their job to provide care because they sort of don't make enough at their job to even pay for care, so they'd rather do it themselves and then subject themselves to that stress. So people have awful decisions that they have to make in this process. The politics, of course, something that's been around for a while now. I think it's been more intense in recent years, and there's a lot of stress related to that. Some old racial tension is coming back, things that some of us thought were resolved. I don't think they ever really were, but some of us feel like, oh my gosh, this stuff is back. Like, man, it's rough. And it may bring up some past trauma. A lot of us are sort of in this new era where we're more aware of mental health. We're also more aware of trauma and the things that we've been through and trying to avoid inflicting this on ourselves and other people in the future. Getting that help can be very difficult because trauma is scary. People don't want to necessarily go there for fear of what might happen. And there's a way to do that safely in therapy, but it can be difficult and time consuming and scary. So I get that. Most people they don't pursue that. So if you think about chronic stress, you might think about it working a little bit like this. So this would be an example of an abnormal chronic stress response, right? So typically, well, an abnormal stress response. Typically, you'd have a bit of stress and then it would go down and you go back to baseline. And then you have some stress and it goes down and goes back to baseline. But what you see here is it's not really going back to baseline. It goes down again and sometimes significantly, but never quite to where it was in the beginning. And what you end up with, if you sort of plot the line of the trajectory of this, is that it's increasing. Even though you're getting some relief and respite, your overall level of stress continues to increase. And you can imagine that this would be the case even with something as simple as the drink. If I let you put it down for a minute and then said you had to hold it for 10 more minutes, you're still tired from when you put it down. You haven't fully recovered from that. And I think that can be a sort of a good analogy for what happens cognitively as well. So we think of some of these other factors that will affect your chronic stress. Physical activity, of course, if you're looking to improve your ability to cope with stress, there's probably nothing better that you could do, more effective and simpler than physical activity. Multiple studies have shown that it's about as effective as an antidepressant for someone with depression. And it's also tremendously helpful in channeling the energy of anxiety in a more healthy way, not to mention all the physical health benefits that go along with something like that. Sleep is difficult for many of us. There's some interesting recommendations around this. If you're finding that your sleep is a problem and you're looking to change it, of course, talk with your doctor. There may be a medication, there may be a sleep apnea or some other physical thing that needs to be addressed here. But one simple thing you can try for yourself, well, I don't know about simple, one thing you can try for yourself is avoiding screens before bedtime. There's something about looking at a screen that lights up, like your phone, your computer, your tablet, that tricks the brain into thinking it's still daytime. And it has trouble with the circadian rhythm. The whole thing can get disrupted. At least this is what some research is showing. And so people will suggest that for 1 to 2 hours before bedtime to try not to look at a screen. And man, that can be almost impossible for some of us. But if you find yourself what they call doom scrolling now and then, right? You get on Insta, Facebook, whatever, and you're just scrolling. Oh, look, another thing. It's endless, right? If you notice yourself falling into that trap, and you might say, you know what? Let me just set that aside. I'm going to spend some time doing something that doesn't involve a screen. Anything. It can be, you can listen to audio. That's fine. But it can't be something that's bright. The best way to do it, if you have a way to get outside, maybe on a porch or something, to actually be outside so you can see the lights dimming and your brain understands, like, oh, look, it's nighttime. I need to go to bed, get ready for bed. Nutrition's huge. And so caffeine is something that a lot of people use in our culture to stay busy and active. I don't think people realize quite how much caffeine affects us. It's an incredibly powerful neurostimulant. And, in some cases, even wonder if it should be regulated. It's so powerful. But it seems to be not particularly harmful. It's hard to overdose on. The thing about it, though, is that it can significantly impact your stress level and your sleep in particular. If you want to experiment with something, try reducing your caffeine intake. If you're already using a lot, or if you use caffeine every day, you're probably going to go through withdrawal, and it can be very difficult. You can feel much worse, and so that's when a lot of people quit and give up. But if you're able to get through about the first 4 to 5 days, then the caffeine should be fully out of your system. It's going to be rough, and you might want to do it over a long weekend or something, but if you can do it, then you may not need it anymore, and you may find that your relationship to stress can change considerably. Caffeine can actually help a lot with tension headaches, but it can also cause tension headaches. So, yeah, talk to your doc first, see what they would recommend, but think about that. The other thing about caffeine is if you know about half-lives, so the half-life of caffeine is somewhere around 8 hours, just as a ballpark, right? And so what that means is after 8 hours, about half of the caffeine has left your system. After another 8 hours, another half of that has left your system, but it's still there. I mean, can you imagine how long a small amount could stay in your body? So you might think, oh, if I just have my coffee in the morning, it'll be out of my system by bed. Well, no, actually, a significant amount of it will still be there. Is it enough to impact your sleep? Depends on the person and the situation, your tolerance level, and lots of things. Again, talk with your doc about it. But there's some interesting things here. If you don't have that morning caffeine and you don't need it, you might find yourself sleeping a lot better at the end of the day. Connecting with others is something that we underrate in this culture, I think. It's so incredibly important. There's so much of human nature that is just built on connecting to other people. And if you don't have that and don't do that, there's something very fundamental that changes in our system. And a lot of, I believe, mental illness can result from that. Believe me, I may not look at doing a presentation like this, but I am an introvert. After this, I'm going to go do something that does not involve people at all and recharge my battery. So, like, I get it if you don't want to necessarily be around people or if you don't have time for that. But you kind of need someone. The research suggests that you need one person minimum that you can go to and sort of have a support in them. People who say they have no one tend to have the worst clinical outcomes. So just something to think about. And of course, we mentioned seeing your doctor or therapist if you're interested in making other changes. So lack of resources, right? It's astounding how many of us struggle, even in the United States, arguably the most or one of the most prosperous countries on the planet. There's a lot of people who live in poverty, and you can see the numbers here are slightly outdated. They just increase the poverty limit again every year. But if you look at the average senior, for example, maybe they don't get Medicaid, they're not necessarily poor, but look at their income. I mean, it might be like 1700 a month. Their net worth can vary tremendously based on racial factors. Age is a tremendous factor here as well, because oftentimes the person caring for the senior is getting close to being a senior themselves, or maybe they feel like it. Um, and you can see the sort of number down here from AARP. They estimate that people provide a tremendous amount of free care for loved ones. Like if you were to value this care, it would be so expensive. I mean, I think these numbers would be much larger now, given the recent inflation that we've experienced. But just to kind of give you an idea, it takes a lot of resources to be a caregiver and to live as a senior. It's interesting, like Social Security was never intended to provide someone's complete income in retirement. They were supposed to have been cared for by their family, and Social Security was just a supplement. The culture has changed since then, but things haven't caught up. The Social Security check certainly hasn't caught up. Speaking of broken systems, you want to play everyone's least favorite game? Does Medicare cover it? Well, let's take it one by one. Does Medicare cover home care? No. Actually, it's all these. Home renovation? No. Assisted living? No. Does it cover dental? Not unless you have an Advantage plan that covers it. Vision? Same thing. Not unless you have a specific plan that covers it. Does Medicare cover anything long term whatsoever? No. Does Medicare cover anything for the bathroom? The number one place seniors fall in the home, maybe close in comparison with the bedroom? No, it doesn't. Why? I have no idea. Is it incredibly frustrating? Yes, yes, it is, especially as a social worker like me. So I try my best to fill in some of these knowledge gaps and let people know what's going on. At least if you know, then we can prepare for it, right? Or try to cope with this reality. So let's look at these knowledge gaps. Any of you who might have been afraid of these sharks, maybe you don't need to be quite so afraid. Because these aren't just any sharks. I chose these specifically. You can see here the Caribbean reef shark, the nurse shark, the whale shark, the leopard shark. None of these are really that dangerous. I mean, any shark will bite you if you punch it in the face. Don't do that. But you're probably safe if you were swimming and saw any of these in the water. Now, some of you are like, yeah, I don't care. I'm not reassured. I get that. But you know what? Some of you could be. A lot of things like what happens when you're under chronic stress is that things that are not dangerous can feel dangerous, or things that are actually lower level of risk can feel much higher level of risk. It's a perception bias that gets built into the system. And if you can try to push back against this and go, I know this feels really dangerous, but the doctor says it's actually not that dangerous, and so I need to sort of let this go, that can be helpful. And some knowledge like this can be helpful as well. Imagine in the case of dementia, if you feel like someone is doing something against you purposefully, they are purposefully messing with me, saying they don't remember when I know they do. But if you realize, no, actually, they have dementia, parts of their brain are dying. It can't do that work anymore. And so they honestly don't remember. That's why they ask you again and again. They don't remember they ever asked. That knowledge, I think, can relieve some of the stress through a reinterpretation. So, what do you do with certain behaviors? If you're the caregiver and someone is behaving a certain way, it's causing a great deal of stress. What can you do? What if the person, and this could be dementia or it might not be, but I think we see it most commonly in dementia. What if they say something illogical? Your gut response is often in the don't column, unfortunately. It's just how we're wired as people. If someone says something that doesn't make sense, we want to correct them. We want to explain, we want to argue. None of that is helpful. It's almost always going to make the situation worse and make the person defensive. So instead, people will advise doing things like ignoring it, changing the subject, making a joke of it, and laughing it off. You know what's appropriate for your individual person, right? If they would be offended by you trying to laugh it off, then don't do that, obviously. But a lot of people, if you sort of turn it into a game or a joke, they can cope with it. What if your person is getting very upset? You might want to argue with them. You might feel sort of inclined to ignore them or minimize whatever they're bringing up. But instead, you can always empathize. You can comfort and reassure. The trouble is that if we don't have our own reserves, it's very hard to give that energy to others. But if we do, we're more able to do that. So we'll come back to that piece as well. What if the person starts to wander? They say, I'm going to California. They open the door, they walk right out. They got nothing. Maybe they're not even wearing shoes, right? Maybe they're wearing their slippers, right? It's so tempting to panic. It's so tempting to grab them and restrain them. And I mean, sure, if they're about to step into a road and there's a car coming, yes, you have to grab them and restrain them. That's completely defensible. Anyone would do that. But in most cases, no, you cannot restrain another person, even if they have dementia, even if they're starting to wander. You can walk with them. You can talk with them and say, "Hey, what you doing? Where you going?" You can ask permission to join them. "Hey, can you mind if I come too?" I saw a video online where the woman said, I actually forgot to pack. Would it be okay if I go in and pack real quick and then we can go?" And the person's like, "Well, yeah, I guess. So, let's not be long." "Oh, no, I won't be long. We'll just take a minute. I just want to grab a few things and then we'll go." By the time they got inside, the impulse to leave had left, and she was able to redirect that behavior, right? So you're redirecting, you're trying to supervise the situation, and you're trying to plan ahead for it if you can. What are you going to do if someone starts to wander? What if they forget? I don't remember. Oh, they say something, it doesn't make sense. You already told them, they don't remember, right? Remember? I already told you 3 times. Doesn't help. It's going to get them upset. So instead, you want to try to proactively remind them. And then when they're coming to you, I know it's rough, but try to just answer the question. Even if you have to answer it 1,000 times, if it gets to be too much, you might realize that they don't actually want the answer to the question, they want reassurance. And so instead of providing the answer, which could require some cognitive processing, you might just be like, "Don't worry, I got it. Oh, I took care of that yesterday." That reassurance can make the questioning stop or at least lessen sometimes. What if there's inappropriate behavior, right? I mean, maybe you could imagine whatever that could be, but something that's not appropriate in a social situation, that makes you uncomfortable. Maybe you even worry if it's legal. They're doing something, nudity in public or something. I don't know. What you don't want to do is treat them like a child and scold them and get upset and get very flustered. What you want to try to do is to calmly redirect it and distract them, sort of move in a different direction. All of these are kind of strategies that I've picked up in doing the research, talking to people, consulting with the expert groups like the Duke Dementia Family Support Program, the Dementia Alliance. You know, none of these are sort of panaceas, right, that will cure everything for everyone, but I think they can be helpful to keep in mind. So I mentioned a couple supports. They are mentioned here, and I've got them, I think, later in the presentation as well. Just so you're aware, there is a group called the Dementia Alliance that provides some statewide support for people with dementia and the caregivers supporting them. There's also the Duke Dementia Family Support Program and other regional groups through this thing called Project Care, where you can get a $500 respite voucher to help bring some care into the home or help pay for a short-term respite stay, whether that's something like an adult day program or something like assisted living. It's often out of pocket, but groups like this can help offset the cost. Sometimes the Dementia Alliance even has some funding that they can chip in too to help make this more affordable. Home care can be a super, super important and helpful thing. There can be lots of barriers when talking about how to implement this, get people to accept it, make it affordable, but it's something that we want to have on the radar and be starting to explore the resources for. In certain cases, like if someone has Medicaid or if they're a veteran, the home care could even be free. So we want to make sure we don't route it, you just sort of write it off very quickly because of the cost. And the doctor can also help persuade the person to accept it. So, like, there's barriers here, but there's also ways to address these. Senior day programs, Charles House is the one in Chapel Hill. Dementia is not a barrier to that. So, if you're interested in somewhere a person could go during the day, that's just one example. Many counties will have a senior day program. So, you can call the county and check into it. Veterans can often qualify for a pension and things like aid and attendance or this homemaker and home health aid to help get some free care or covered care in the home. So that's a lot of what I do in my role at the clinic, is helping to talk with people about what's your situation, what do you need, and then what are some of the options and resources that might be helpful for you. Most people have never heard of this kind of stuff. So talking about knowledge gaps, a lot of people talk about Medicaid and they're quick to tell me, oh, wait, I don't qualify for Medicaid. And I go, which one? Because in North Carolina, there's more than 20 different programs that involve Medicaid, and many of them provide very different resources and have different requirements. So again, these numbers are slightly outdated. This is last year's numbers, but it does give you a sense of, based on the single person's income and their assets, what program might be available and what it might do. And you see, some of these are not quite as restrictive as people assume. Yeah, sure, it's hard to get full Medicaid because the limit's only like $1,200 a month, but there are other types like special assistance, and there's different versions where you can get it in the home or in an assisted living facility, that if your income is low enough and your assets are low enough, or your assets can be spent down to become low enough, maybe you pay for home care out of pocket for a while, for example, then you could qualify for some of these supports. And the last one is one that almost very few people are aware of, but it can be helpful is just to know there's a safety net. Even though most folks may never qualify for Medicaid, there is one type, this long-term care Medicaid, that only does one thing. It pays for a nursing home, and it has to be for someone who's medically, qualified for that level of care and needing it. But it is an option. Even if your resources run out, even if your income is too low, even if it's unsafe to remain in the home, there is a place that you can go and there is help paying for it for almost everybody. So, it may not be the best option, but it is an option that's there if we need it. I think that can be reassuring sometimes. Let's talk about that emotion that I mentioned, right? Caregiver guilt, number one emotion that I hear. And I hear people say things like this: no one's helping me. It's all my responsibility. Well, I don't want to bother anyone. I have to do it. I'm the only one she trusts. I want to, but I don't have time, or just straight up, I don't have time. And that guilt can make you feel like you're drowning. It's like you're never good enough, right? Nothing you do is ever sufficient, but you have to at the same time. It's like you're obligated to fail. What a horrible feeling to have to live with. And so I think the way out of this isolation is to sort of ask, who can help me and how can they help me? Is there anything that I am doing now that I could delegate to another person? Even if they don't want to be involved in a big way, is there something small that they might be willing to do? One common example I hear is that maybe there's a person in the family who has no interest in providing caregiver support, but maybe they're interested in tech, right? They really enjoy things like that. And so maybe they'd be okay Googling for some resources. Maybe they would be okay setting up auto pay on some of the finances that are going on here, right? Maybe there's little tech things that they could do that would be kind of a one and done thing, but could be really helpful and even provide long-term support. Maybe there's someone in the family who loves to cook. Would they be willing to prepare some meals, maybe freeze them, you could use Meals on Wheels, sure, but you might need more. They might not want that kind of food, whatever. Are there ways that you can get clever in how you could delegate small pieces of the task? Nowadays, if you go on the App Store, you can even check out some apps that will help caregivers and family members coordinate who's doing what. I don't have a particular recommendation, but give them a try. Go in the App Store, search for Caregiver. You'll probably find lots of apps to help coordinate that. Maybe someone loves driving and they'd be happy to do transportation. I don't know. Lots of options here. Um, I think bringing others into it can be difficult, right? Especially if they're people the patient doesn't know. And so the question is like, how can I introduce others and help support that transition, realizing that you can't do it all by yourself? So you may need to get the doctor involved. You may need to get a family member who they have more rapport with, maybe they trust more, and get them to bring up the idea of this thing. Maybe it would be rejected from you, but maybe they could hear it from the doctor or this other person. realizing on a fundamental level that you're not alone. People have gone through this stuff before. They continue to go through this. None of this is new. It just feels like you're the only person to have ever gone through it. But there is support. And remember that connecting with other people is intrinsically valuable. Sometimes people tell me, well, there's no point in talking to other people. They can't help me. Well, believe it or not, just venting to them can help you. If that's all you do, it might not help, but I think it can be an important part of self-care to have someone you can vent to. I think most of us have experienced that in life. Perfection tendency often goes along with this feeling of guilt that your person, your mom, whatever, deserves the best. I can't trust other people. I couldn't live with myself if anything were to happen to them. That's not good enough. It has to be better. It has to be perfect. I hate to tell you, there is no perfect in this world. It does not exist. I would love it to. I cannot tell you how much. It does not. So we have to accept that very difficult reality that the goal here is not perfection, it's good enough. And let me bring your ideals down a little bit here. A lot of what we do in geriatrics is helping people realize good enough is a lot more basic than what you might think. Geriatricians are often a lot more comfortable with risk than other doctors would be because we realize that it's part of life and we need to balance all of this stuff carefully. We can't just lean one way or another automatically. So if you had to take a guess, how often do you need to bathe to be safe? And by that, I mean no skin breakdown, no sort of infections, very basic stuff, keeping your skin clean enough that it's not going to cause problems. If you said 1 to 2 times a week, you're right. Most people don't. Most people say like, oh, 3, 5 times a week, something like that. No, you just need 1 or 2 baths a week. And if you've ever wondered, when a person has home health, they sometimes will have an aide come in and help with bathing, and it's usually once or twice a week. Why is that? Well, because that's what the research shows is medically necessary. What about a person's weight? Well, if their weight is stable, whatever they're eating is probably fine. In some cases, we actually want them to gain weight. And so what they've been trying to do their whole life, lose weight, we're watching weight, we may not care after a certain point, and it may actually be beneficial for them to gain weight if we know that they're probably going to lose it in the future because of a medical condition or something that the doctor foresees. How active does someone need to be basically healthy? Well, if you think about the average American, we're only active about 2 hours each week, if you can believe that. We spend so much time on screens and sitting and laying down. In terms of moving, physical activity, maybe something that gets the heart rate up, very uncommon for the average American. So the average senior, you can imagine, they usually watch TV for 4 hours each day. And if they say they're fine, even if you know they would be better off if they did more, maybe it's fine. If the doctor says it's fine, maybe it's fine. And if you don't have that doctor's support, a geriatrician at a clinic like ours can help provide that perspective. There may come a time when you have to intervene because they're getting pressure injuries, they're moving so little. That's a problem. But until we get to there, maybe it's fine. When in doubt, ask the doctor. Don't trust a social worker for medical stuff. Go to the doctor. I'm just the start. Lack of boundaries, right? People will tell me, I haven't had a break in years. She walks all over me. How can they treat me like this? I can't take care of myself. There's no time. The number one reason I hear people can't take care of themselves, there's no time. I don't know about that. I mean, yes, you're right, but I don't know about that. Let's look at that a little more. So one thing is you're doing a lot, and some of that's because the limits are hard to accept. To say to yourself, there are certain things that I can't do. There's certain things I'm not willing to do. That's okay. Other people can help, or those needs actually might not be needs. They might be wants. We may need to address them differently. So it can be really helpful for caregivers to think through what are your boundaries? What are the things that you're completely willing to do? What are the things you're willing to do even though you don't really like it? And what are the things you are unwilling to do? To write these down ahead of time, to think about them ahead of time. And then you'll be more prepared when the situations actually come up. The other trick is to enforce them. When you've decided there's something that you cannot or will not do, which is fine, you'll have to communicate that to people who need to know, which is hopefully the patient, but if they have dementia, not necessarily. It might be someone else. And to put a plan in place of if that happens, here's what we're going to do instead. That can be hard to plan for, but it can be important. And if you have that plan, you're more likely to be able to keep your boundary because you know what you're going to do instead. If you don't, you'll probably give in and say, oh, it's a crisis, I have to do it. Well, we could have prepared for this a little better. I mean, granted, it can be hard, but if you talk to someone who's experienced this before, it can be a little easier. Respite is huge. Getting a break, even a little bit now and then, whether it's through family, hired home care, a senior day program, whether it's assisted living or placement, tons of options here. We'll look at a bit of these, a little bit further here, and I'm happy to discuss it further after we kind of wrap up for today. So when it comes to respite just refers to a break for caregivers. It's anything that lightens the burden on a caregiver for a little bit. And it often comes with some additional benefit for the patient as well. But the point is to give actual caregivers a break, right? People don't necessarily pay attention to it. Like we're eager to help others. We're hesitant to help ourselves. And we sometimes even forget that we need that help. But respite is there to remind you that you do have limits. And if you push beyond them, there are consequences to that and you'll feel them, and your loved one probably will too. So I don't necessarily recommend anyone on this slide. That's not something that I would ever do. But I will tell you that these are common ones that our patients have used. If you're looking for someone to provide home care, these are just two examples. There are lots and lots of companies, and you can Google home care city, home care county, like put in your information, and you'll find it. There's tons of these agencies out there. It can be hard to know which ones are good, but what I find is it often comes down to the individual caregiver more than the actual agency. So it's often more of a trial and error kind of thing than preparing ahead of time and then choosing the perfect option. There's no perfect in this world. But if you're feeling overwhelmed and just need a place to start, this is somewhere that other patients have told me that they've started. If you're just looking for a local company, shouldn't say just. If you're looking for a local company, someone who's flexible with their hours, all of these rates tend to be high. You're going to be paying money for this, and that's very unfortunate. I think it's way too expensive, but people need to make a living too, and I also get that. So if you're looking for, a local company that's flexible in what they can do in their hours, check out Acorn. If you're interested in a company that provides full service or at least the option of full service care, and by that I mean not only providing the home care, but also things like transportation, accompaniment to doctor's offices, which other companies can also do. I think Acorn can do, but also things even beyond that, things like case management. If you basically want to hire a paid relative, almost like a daughter for hire or something, you can hire a person and say, look, I can't do any of this. I don't have time. I work full time. I've got kids. I got to deal with my own life. They are now your pretend daughter. Deal with that, or your pretend loved one, right? Your mother. Deal with that, and they will. I mean, you pay them for it, but they will totally act in that role. So they'll be like, okay, what do you need? Let's go get that set up. I'll call the company. We'll get this, set up for you. Oh, you need transportation? Okay, let me help set that up, or let me just bring you to it. Oh, you're going to the doctor? All right, let me take notes during the doctor visit. Share that with the loved one, right? Identifying needs, putting the supports in place. And certain agencies, Arosa as an example, can go beyond that too. If you get to a point where the person is refusing help over and over, and it's gotten to the point where it's dangerous, then you might need to pursue guardianship. That's a last resort option, and you'll want to talk closely with the doctor before you decide to do anything like that. But sometimes it is the only way. And so Arosa can help with guardianship. They can be the guardian. They can do some power of attorney work. They can refer you out for someone for financial power of attorney if you need someone to manage the funds. But there's a lot that they can do. So there are these supports, and yeah, they're expensive. But I mean, hey, if the person has some savings, what's it for? Like, a lot of people want to pass it on to their kids, and I get that. But you're going to suffer tremendously in the process of doing this. Everyone will. I think it's more advisable to use the money on care. And by the way, if you're thinking about maybe one day needing a nursing home, that's what Medicaid's going to want you to do. Show that you spent down the money on care. So you're doing what you got to do. Now, when to start? What type of care? How long is this going to be needed? Right, this is hard. And so these are questions to talk about with the doctor and the social worker to figure out, like, what do we put in place? How much can we spend? What's the life expectancy of this person, right? I mean, there's some hard questions to think about in making this practical decision. Many people don't think about a senior day program, but it's often a very affordable alternative to home care. So yeah, there's just a couple examples in Chapel Hill, Hillsborough, and Durham for you to consider. And this would be somewhere where you would drop the person off in the morning and then pick them up in the afternoon, much like you would taking a child to daycare. But of course, for seniors, it's different. There's structured activity, there's social support. Some of these are sort of just day programs, and some of them are day health facilities. As you talk with them, you'll learn the difference. But for example, Charles House is a day program. They provide simple social support. They can help someone with, certain things, maybe very limited support with something like toileting, but not too much there. The person's mostly independent. They might need some supervision. They might need some redirection. They can accommodate that. But when it comes to medical stuff or incontinence, it's not really something that they can handle. They're not credentialed to handle that. However, Soltis Place in Hillsborough is. They're a day health facility. And so they actually have a hospital bed that's available in a room in their facility if it becomes needed. They have a nurse on staff who can administer medications, do wound care, like anything that may be needed during the day can be done. I mean, obviously, talk with them about what they're able to do practically, given their time constraints and the other people there. There's no promises in what they can do. But if you talk to them, you can figure out how they could be able to support you. And even if the person has some medical needs or incontinence, don't rule it out automatically. Talk to the places first and see if it's something that they could accommodate, because many of them can. And like the Durham example, there's many different locations as well. So you can contact them and learn about the different options in the county. And these are just three. Like I say, you can always Google something like your county name, senior day program, and you'll find it. There's actually a list that the state puts together as well of all these facilities and how they're regulated and their inspection scores and that kind of thing. And of course, assisted living respite or even independent living respite is another option as well. So maybe they are not ready to move to another place, but they do need some time. Maybe they're recovering from a medical procedure and just need extra support. Maybe you're just getting really stressed and you'd like them to have someone else care for them for a while. This can be extremely expensive, but if you're only doing it for a week or two, different places have different minimums, but usually it's a 2-week minimum. Sometimes you can get less. Sometimes it's only a day or two. Having the person actually out of the house in a safe environment where you don't have to worry about them can give you the time you need to do really important tasks like applying for Medicaid to help them get into a certain level of support, finding them a more permanent assisted living facility. So sometimes that great expenditure can actually be worth it. And these are just some thoughts, of course. I mentioned a lot of these, but just kind of wanted to put them here. And again, all of this information will be accessible to you guys. I'll make sure you have access to the slides. I've included the numbers for dementia-based support, for caregivers, and for patients. For VA, many of our seniors are veterans. And so veterans, it's always a very complicated system, but they do have sort of a one half for healthcare and one half for the other benefits that the person is entitled to. The process usually starts on the healthcare side. So if I have a veteran who's not connected with resources, the first thing I want to do is get them a VA doctor. Find the local medical center or whatever and get them established there. Those providers are often much more versed in what's available and they can help connect them with other supports. If they are having trouble, you can also reach out to benefits. That's sort of the national benefits number. And in most counties, there's also a VSO, a Veterans Service Officer or Veterans Service Office that they can contact and get help learning what they're eligible for and not eligible for and how to apply for these benefits. The other thing that I always tell people is, especially if you're not familiar with the county and its offerings, there is often a lot that the county will offer that is free or low cost. Sometimes it will change over time. Grant funding is often involved, and so offerings can change significantly from month to month or year to year. So it's not something where I can necessarily say, oh, just call this county office. They have X, Y, and Z. They often do, and I might not know about that, right? Or it might have just changed. But what I do say is call your local Department on Aging, or if you're in a more rural area and there's not a lot of county-based resources, you might call your area agency on aging that sort of supervises multiple counties when it comes to seniors and resources. And just ask them what's available. Maybe describe some of the hardships you're experiencing, and see if they have any supports. In a lot of counties, they have medical equipment lending programs, for example. So if there's, we mentioned nothing in the bathroom is covered by Medicare. So if they need a shower chair, I mean, yeah, you could go to Walmart, Amazon, whatever, or a local medical store and buy one. they can be expensive. I mean, it depends on what you get. They can be pretty affordable too. But if it's not affordable for you and this person, maybe there's a lending program where you can get one for free while they need it. A lot of counties have free in-home care. There's often a waiting list for it, and sometimes it's only Medicaid. But believe it or not, in a lot of counties, they have both. They have the Medicaid support and also just the general senior support. So it never hurts to see if they have that support available or if they maybe have a list of people that they could recommend that you contact. So as you start to think about these resources, a lot of people are going to get, again, trapped in that guilt. And I just wanted to throw this in here as a way to remind you of how you can get out from under that. Instead of thinking about every task as something that you have to personally do, you can think about where it will fall on this sort of chart, right? So if it's something that is very urgent and very important, that's the red square. Yeah, you got to do that. It has to be done now. Let's do it, right? But what if it's very urgent but not that important? Maybe you can delegate it. And in some cases, you might even let it go. It's like, yes, it needs to be done, but if it's not that important, what if it doesn't happen? That's interesting. The deadline is coming, but it's not that important. What if we just let it go? That's interesting. What if it's very important but not urgent? Well, that can go on your calendar. But what you don't want to do is put everything on your calendar, right? If it's not that important and it's not that urgent, consider just dropping it. Let it go. If it's good enough without it, we're going to go with good enough. So no matter how you find that support, whether it's a cognitive reframing, whether you choose to get into exercise, whether you just practice some self-care, take that dog for a walk, go to the massage that you've been putting off for ages, go to the state fair when it's in town, right? Maybe you just use your weekend in church. Maybe you go to church on Sundays or whatever, and that's your support. Maybe it's a different day for you. Maybe you have a different way of expressing your connection to something larger than yourself. However you feel, whatever you do, connect with that. Make that a priority. Because if you don't, you're going to burn out and then you won't be there for yourself or for your loved one. I've seen it. I've seen people get to the point where they didn't take care of themselves. They didn't do any of this stuff. And then they go, look, I'm done. I can't do this anymore. I'm done. And now we're scrambling, trying to find a stranger to take care of their loved one, or we're turning over their care to the state. Let's not let it get there. Let's take care of ourselves now. So you can make time for you, make that a priority. You can challenge the fear and the guilt that goes along with this, and you can make peace with the idea of good enough. Ooh, easier said than done, but worth trying. All right, that's what I got for you guys. Thank you so much. I'm gonna stop sharing.
Thank you so much, Brian. It's really a wealth of information and really helpful and just valuable information, I think, for caregivers and for all of us who provide care, even if it's just for dogs.
There you go.
So I just wanted to open it up to folks if anyone has questions for Brian before we end today.
I saw the one question in the email. I'm happy to address that if we'd like. And
Sure.
while I'm sort of addressing that, yeah, anyone, please feel free to put your questions and comments into the chat, and we'll do our best to get to some of this. I think the question that came in was kind of multifaceted, but a lot of it was the idea of aging in place versus not, and how to choose the right level of care, and how to choose when to explore a certain level of care. And indeed, I mean, these are things we experience very, very commonly in the geriatrics clinic, right? So someone will come in, and a lot of times it'll be we're kind of at our wits' end, right? We've been doing this a long time. We're getting tired. We don't really know what to do. And so we explore options, right? And so the idea of aging in place is something that most seniors want to do. Granted, there are some people who are like, yeah, I'm fine. Just, I want to go to independent living. I want to go to a nursing home, whatever. And they're cool with that. Okay. Some people feel very strongly they do not want to be a burden on their children no matter what. And so they're happy to go that route. And some of us are going, yeah, I wish. No, but the vast majority of seniors, it's like 90% when you do surveys, say, I want to stay at home no matter what, right? And I get that. I mean, who wouldn't? I love being in my house. I adore it. Ask my wife. I don't want to go anywhere. In some ways, the isolation of COVID, I was loving it because I was like, oh, we get to have delivered groceries and delivered food. This is fantastic. Most seniors want to stay at home, right? So how do we balance their desire to stay at home with the need for safety? And so that's what our doctors talk about a lot. One of my favorite docs here is Dr. Margaret Drickemer. She actually just retired, but she's working in hospice now. And so she would present it to patients just like that. She would say, everything we do in geriatrics is about balancing your freedom and your independence and your happiness with your safety. And we really want to strike a balance here. We don't ever want to say, well, you have to do this because safety. I mean, sure, there might come a time where we do have to say that, but those are in extreme situations, right? Most of the time, you're looking at like, yeah, your opinion, your happiness, your freedom and independence, these are important to us. And we want to side with those as much as we can while still ensuring that basic needs are met and basic safety is present. So usually this can be done, right? The idea of aging in place would be that as a person's needs increase, the amount of support that they get in the home and from the community has to also increase. So they do have to be open to this idea of having people come into the home and help take care of them, or maybe going to a senior day program or a combination of the two. And, hopefully that can continue to meet their needs. A lot of it can come down to cost, quite frankly. There are lower cost options for home care. We talked about some of the free options, and there's different types of home care. So you can get someone who just is a companion, or you can get someone who helps hands-on, and the costs will be different. So maybe you need someone who's hands-on for a bath several times a week, or whatever you decide is appropriate, maybe only one or two, right? And maybe the rest of the time they just need eyes on and supervision. So that can help reduce costs a little bit. Also, if you end up doing something like a live-in caregiver, maybe you're even doing a sort of quid pro quo thing where someone is like, we will provide you with a place to live, maybe some food, maybe some transportation in exchange for you providing home care for our loved one. That can be an ideal situation in some cases. And there are some agencies that will also offer in-home care. And because the person's living there and getting some benefits out of that, the overall rate might be lower. So there's ways to think about it, right? And talking with someone like me, a social worker, talking with a doctor, ideally a geriatrician, can help you explore all these options, make sure you're aware of them, see what's reasonable and affordable, and what resources exist in your county. Now, it may come to a point where we decide this just isn't working. It's too expensive. It's not meeting their needs sufficiently. They're falling repeatedly. They're not taking their medications as directed. Even with encouragement and support from the people around them, they need facility-based care. And it can be a very difficult conversation for one who wants to live at home and stay there no matter what, or a family member who feels incredibly guilty about that, or if the cost is a significant problem. So there's lots to sort of talk about and unpack as we go through this. There's no right or wrong. Um, yeah. And I think the sort of answer to the question of like, what do you do and when is, it depends. And it's something we really want to think through closely. And a lot of times, if we try to just decide ourselves what we think is right and then say, this is what you're doing, well, you can imagine that doesn't go over very well. If we try to partner with the person and make it work, sometimes that can. The other hard part is if the person has a dementia or another type of cognitive impairment, or maybe a mood disorder, anxiety or depression. Like depression's a mood disorder, anxiety is not, but still, you get the idea. Something like that can make it more difficult for a person to understand that they even have an impairment, to understand that their caregiver needs help, and to accept that help. And so there's some that we can do with medications to help a person be calm when they need to help them sleep at night if they're having trouble with that. And there's some that we can engage with. And sometimes with dementia, you may just decide with the doctor and with the expert advice that we're just going to kind of do this and we're going to do it as smoothly as we can. It's probably not going to go great and they're going to need to move and they're going to hate it, but maybe they'll adapt to it. And the truth is, most people do. Most people have a rough time for the first week or two when they move into a new place. I mean, we all would need time and it takes effort to adjust, right, to a new situation, new people, new routines. But most of us can adapt. Even people with dementia can adapt. I've seen it take as short as a day. Sometimes people just move in and they're like, yep, I live here. I've always lived here. This is great. And the caregiver's like, really? It was that easy? I had no idea. Other times it's rough. I've seen it take a month. I've seen it take 2 months. One time a person went back home, had to get their meds addressed, sort of changed, right? Addressed. And they moved back in again. One time they went into assisted living and they wandered. That wasn't safe. And so they ended up going back home and they moved back in at the memory care level, which was a locked unit. And that was a safer alternative for them. So there's lots and lots of options to think through. Some of them can be very difficult, but that's what it's all about, right? It's that conversation with the patient if we can, with the caregivers, and sort of coming to that joint decision. And if it's something that is an undesirable option, that we do our best anyway. Cool. I saw some questions coming in, so feel free.
There's there's one about ideas about ways to allocate funds to an agent or paid caregiver so they can buy needed items and have more autonomy and decide what to do.
Yes. Oh my gosh. Finances, of course, can get complicated, and I'm required to give the disclaimer. I'm not a financial advisor, lawyer, any expert like that. I've seen people get creative with this, right? So sometimes you'll run into a situation where the patient wants the autonomy of controlling their money, but they're just not able to do it. And sometimes that's they just can't write the check, and sometimes it's they just can't understand that they've already paid that bill or other things like that, right? So sometimes you'll need to get the doctor involved. Sometimes there's a process to go through in terms of a representative payee. So their Social Security income goes to someone else, right? But hopefully you can start with just a sort of empowering them as much as you can and taking the pieces off their plate that they don't need. So, for example, some seniors just hate paying bills. They don't like going through them and writing their check and balancing their checkbook, which many of them still do and have done for decades. And you can say, hey, I'm willing to do all this for you. Can I just take this off your plate? And then you put the stuff on auto pay and we're good. But what if they still want some of that autonomy? Well, can you write the check and then they check it over? Or vice versa? Can they write the check and then you just quietly check it over before you mail it? Like, so you can do a sort of a covert support like that. The other thing that I've seen people do is maybe you get a bank account and a debit card just for that senior. And so you know that they're going to overspend if they have access to all of their money. So you don't give them access to all their money. You have an account and they have a balance. And if they try to go over, it will just decline the card. You want to watch the fees of overdraw, right? Overdraft or whatever. But there's often ways you can deal with that and lock it out. And yeah, I mean, you could do a credit card with a low limit, and then you handle the payoff of it, right? So there's maybe you give them a cash allowance. I mean, I've seen that happen too. And you got to be careful how you do it and be respectful in it. But there is a way to make sure that the senior has some control over money if they're able to. The other thing you can do is kind of remove their need for that, right? So if they usually would be spending that money and going out and buying a lotto ticket, maybe you just go with them. And you're like, well, I'd rather we not buy the lotto ticket. I kind of don't want to spend that money. They're not going to win anyway. But it could be a thing. Maybe once a week, the two of you go and you buy lotto tickets. It still meets the need, but you're doing it in a supervised way.
Great, that's really helpful information. Someone said that this is one of the best presentations on caregiving, very thorough and relevant to what this person's experiencing and caring for her parents. And also that she knows you personally from the UNC Geriatric Clinic. So
Oh, I love it.
shout out there.
Nice.
And somebody mentioned that for free durable medical equipment, like bathroom items, you can try the Facebook group Buy Nothing.
Yes.
Buy Nothing Chapel Hill, Buy Nothing Durham.
Yep. Yep.
And I think
There
there's
There are
also
actually apps for that sort of thing as well. I think there's one called Free Cycle. Like if you go on the App Store and you put in like free, I mean you're going to get a lot of garbage apps, but there's also ones that are like local, right, where you can tap into local things. I had one a while back that it would even give me an alert on my phone every time there was medical equipment that was put out as available, and it was amazing how often the stuff popped up. Like, the person's need changed, they moved, they passed away, right? And there's all this equipment and the caregiver doesn't know what to do with it and they're overwhelmed dealing with this change. They would love for someone to just come pick it up and take it away. But other than that, there's nothing they can do. So sometimes they'll just post on one of these apps. Yeah, Facebook has been a huge source of support for dementia as well. There's lots of groups that some of my patients and caregivers have said are really good.
I think go ahead.
Okay, I don't mean this as a shameless plug. I'm actually doing this as a way of sharing a resource, but I don't know if people know or not, but Jewish for Good is opening an adult day program this fall coming up. And so that is also will be another adult day program in the Durham area. Sorry, excuse me, it's the BeginToCenter.org. It's been put in the chat by John DiMartino. So thank you for
There we
doing that.
go.
If you're interested in learning more about that as well. But it's
There
just
we go.
one more adult day program in the area.
Yes.
This is what I love too. Like sometimes people will be like, well, why would I join a caregiver support group? Like I know my person best. I know what to do, whatever. You don't know about these resources. And how would you encounter them? But if you're in a group like this, then someone's like, oh yeah, I use this app, I use this thing, I got this for free from this. And you're like, I had no idea that existed. There's so much power in social networking. They call it social capital. It's a whole nother way of gaining resources.
I think that there's also, and correct me if I'm wrong, but I think that there's a lending, just back to the medical equipment piece through Scrap Exchange, that there's a lending program through that as well. So, you know, you could
Cool.
certainly contact Brian, or you could contact us if you have other specific requests or community needs. But I think, like Brian said, there's a lot of social capital. There's a lot of networking that can be done in this area.
It's amazing what people know, but you would never know unless you ask.
Yes, I'm just looking through the questions. Another just really affirming response to the presentation today. I think it's really invaluable information for people, and just really helpful, because like you said, it could be really alienating, and just that reminder of being good enough, I think is huge for caregivers.
Oh my gosh. I mean I struggle with it myself. I want everything to be perfect. Like, you know how many times I went over this presentation? Like and I'm still looking at it like, nah, oh, I duplicated that. That's probably not necessary, whatever. It's like, you know what? At the end of the day, it's good enough. The point of us was to meet, share some information, right? Maybe get a little guilt off of you. And so I think that applies for all of us. Yeah, there's so many times I'll speak with the caregiver. Like, oh, I give you an example I ran into. I had a caregiver who was very, very upset because their loved one had a dog and the dog wasn't getting much exercise. Like, and to them, this was a big deal. Like, the dog was not happy and healthy. It was just laying around the house. And I'm like, you know, on the one hand, yeah, I hear that. I would love for this dog to be able to go on walks every day and run and be happy and healthy. But like, is the dog going to the vet? Are there medical problems? No, not really. I mean, so okay, the dog lays around. Like maybe we just accept that. Maybe that's okay. It's not great. It's not perfect. Nothing is. But maybe we roll with that. I think where it gets tricky is with things that impact health, though, right? Like so, medication. They're not taking this med. Well, sometimes we can't just say, okay, I guess they're not taking that med. What's weird though is sometimes you can't. And you really need to talk with the doctor and be like, okay, so they're not taking this med. What do I do? Sometimes it's figuring out why, right? Maybe it's too big of a pill and they can't swallow it, right? And so we need to think of other ways to address that. Maybe it's that they're taking so many pills, they're overwhelmed by the number of pills. And so if we redirect and focus on like, okay, let's cut out the supplements, let's cut out the fish oil, let's do whatever the doctor says is okay, then you can focus on the most important meds. Sometimes you can change the dose. And even though it would be ideal to give it 2 times a day, maybe you can do an extended release, maybe a little higher dose in the beginning of the day, or just focus on the end of the day to also help them sleep, right? So there's ways to get clever and creative with all of this stuff. And things that feel like an impossible obstacle don't necessarily have to be. You just need someone to talk through your options and figure out what would be safe. And then to allow yourself to hear that answer, right? And to go, well, I deeply don't want it to be this way. I hate this, but this is the way it is, and it's good enough.
Well, thank you so much again, Brian. Does anyone have any other questions? Okay. Well, just a few announcements. I think Jenny put the link to register for tomorrow's program in the chat. Tomorrow's program will be with Christina Hall. She's a senior and specialty move manager and founder and owner operator of Transitions Made Simple. And the program is about effective downsizing and home adjustments. So I think that will dovetail nicely with today's conversation. If anyone is interested in learning more about any of the information that Brian talked about today, the video, the links, and the PowerPoint will be available on the website. And we will share that with you as well. And we will have an evaluation when we send that out as well for all of our programs this week. And if there are other resources that you are looking for, or programs like the ones that we talked about, either like Care Partner Support Group or Memory Cafe or the Adult Day Center here at Jewish for Good, you're welcome to contact me or Jordana, Jenny, or Stacy, any one of us. And we'd be happy to answer your questions. But just want to thank you again, Bryan, for such a thorough and warm presentation today.
Oh, thank you for having me. Shameless plug, I put the UNC Geriatrics Clinic phone number in the chat there. So, yeah, I mean, honestly, if you're feeling like you would like that evaluation by a doctor, if you want the option to consult further with a social worker like myself, give them a call. There's no referral required. You know, we take most insurances, Medicare and stuff. So, yeah, give a call if you're interested.
Awesome. Right. Well, we will see you all tomorrow. And looking forward to learning more with you all again tomorrow. Thanks again, Bryan.
All right. Thanks all. Have a wonderful day.
And someone asked if